And good morning. Welcome to the Kickstart. Appreciate y'all being here today. I am Harlan Pickett. Every week, except whenever I can't make it happen for some technological reason, we start your week off with industry news, trends, and updates. We're going to do our countdown and then we'll get started. And good morning once again. I am Harlan Pickett, president of Eagle Care Health Solutions. It is great to be with you again this Monday morning. Hey, over the last couple of months between travel and holidays, it has been quite the challenge to get this going on a regular basis. I think we're going to be back on track now. Don't have any foreseeable travel until we head to NABIP at the end of the month, but I think we'll even be able to make it work then. Once again, anytime you change platforms, there's always a little bit of a challenge. A couple of quick notes for you guys before we jump into the stories for today. If you missed our events last week, we had a couple of really, really great events last week. We had the monthly Why Does Healthcare Suck that we did on Tuesday. So you can go back and find the recording of that. That is one of the reasons we switched to video versus audio. Is when we did the audios before, there was no way to capture that in a good way so that it would be able to be listened to again later. So that was a great event that we did on Tuesday. And then even better event on Thursday that I did with my buddy Tim Urich, where we talked specifically about different ways that small companies, small businesses can save money, how they can control their costs in a much more effective way. Tim had some great ideas on that. So go out and find either one of those events. You can go out to my profile and then just go down to my events and find those and watch the stream of them. As for today's event, don't forget that you can always put in comments in the chat, and my lovely director, my wife, Kelly, will make sure that we gather all those together, put those in here. If you do that during the actual show, then I'll be sure to answer those questions, or even look at your comments and make sure that everyone hears that. If it's after the show, then we'll certainly follow up with you as well. All right, so let's go ahead and get this show on the road. Well, every year we get a study, I guess you can say, about the high claims cost and injectable drug trends analysis that comes from Sun Life US. And it really tracks, it really looks in depth, in fact, at those high cost claims. Now, what's really tough as someone who is proponents, of course, of self-funding is that these are the plan killers, right? These high cost claims are what can actually kill your plan, depending on the way it's set up. I mean, obviously, they're looking at stop loss numbers here because this report it examines 60,000 different stop loss claims. And this report now looked at claims from 2020 to 2023. And, unfortunately, it didn't show, it's nothing that's very surprising here, but 87% of self-funded employers had at least one of these claims. So at least $1 million claim during that time. The biggest, I think, surprise in it, the biggest trend in it was cardio. So cardiovascular disease has now risen to the second highest paid claims position. It has overtaken blood cancers in that position. That's the first time since they started doing this report 12 years ago that has happened. Blood cancers have been in that position, and now cardio has jumped ahead of it. In fact, it had a greater increase in cost than the trend itself. So a 33% increase over that time period for cardio and the trend was not as high for the overall claims. And now, not surprisingly, malignant tumors is still number one. It is, in fact, twice as much as cardio even. So it is way, way ahead of everything else. Once again, not surprising. Though we know that there's typically no short treatment for those, and the cost can get very expensive very quickly. Also, as the law of numbers tell us, and once again, not necessarily surprising, but it's good to know, and that is the top 10 high-cost medical conditions accounted for 72% of all reimbursements, of all stop-loss reimbursements, and the top 20 conditions accounting for 92%. So there's no doubt that that group of conditions is what's driving the cost on your health plan, and of course is what's causing your stop loss to potentially increase. Now remember, here is something to keep in mind, because this is very important. If you're self-funding and you're using stop loss as that protective piece, remember that even if it does go up because of one of these claims, that's just a small piece. It's not like your overall plan. In other words, if you get a 25% increase in your stop loss, that's not a 25% increase on the overall plan. That's a 25% increase on just the part that's stop loss. So it can be alleviated in many ways, and it's not as dramatic as it could be, but it is something you've got to keep in mind, because this is a reality. This is why even bigger plans have some type of stop loss, because you can have these catastrophic claims. You know, the largest claim that occurred over this time period was for $11 million. Wow, man, I mean, that's a huge claim. But it would be tough to guess what that was for. I will tell you what it was for. It was for newborn and infant care. So who knows what exactly happened in that situation, but we know that was a crazy, crazy amount. Now, those claims that exceeded $1 million, there was 32 of those claims, and that's nearly double the amount from 2022. So that's a pretty big deal. It is something to keep in mind, but it is why we have stop loss. And I think that it proves out once again that these plans can be done, and these plans can be very good quality plans, but you've got to make sure you've got that extra layer of protection in there. All right. I thought this was an awesome, really, really awesome study that I looked at that was really kind of diving into why do employers choose a health plan. Now, while it was an awesome study, I didn't like the results. I didn't like them at all. It just shows how much work we have to do, because what we really want folks to do is we want folks to get a health plan where they have excellent access to health care, quality, affordable health care, right? That's what we really want, is we want people to have a plan that they're not concerned about the network, but they're concerned about the quality of their health care. Well, so much for that, right? The 2023 Consumer Engagement and Healthcare Survey that was done by the Employee Benefit Research Institute, they're really not surprising benefits, but it just shows how much work we have to do. The number one, as a tie, the number one thing that people want in a health plan is a good network of physicians and hospitals. Womp, womp, womp. Well, I understand that's just kind of what we've been trained, but the problem, once again, is just because you've got a network of physicians and hospitals doesn't mean they're quality physicians and hospitals. There's no way that you can have that type of information in a traditional PPO or HMO plan, because they're not going to give you that. So I understand that that's what you want, but you got to be willing to think of things a little bit differently, because we can give you that. It just may not include all the ones that you were hoping, because we're going to actually use the data that it's data driven to show that it's a quality plan. Also, as much as we talk about how we have insurance for our vehicles and we don't pay insurance for auto for oil changes, we don't do it for tire rotations, people still want the day-to-day things paid for on their health insurance plan. Tied with a good network of physicians and hospitals is low out-of-pocket cost when visiting a doctor. So that is another one of the things they want. And then, of course, lower premium costs. All those three tied, which I think is awesome, right? What do you want? I want a plan where I can go to any doctor, any hospital I want to. I don't want to pay anything when I go to the doctor, and I want my premium to be low. Yeah, don't we all, right? Now it is funny because that's a perfect plan, right? I mean, that's exactly what you want. But how you get there, and we can get you there, is not what you expect. So that's kind of a funny little deal there. Prescription drug coverage was right behind there as far as what folks want in a health plan. And then specific coverage included in a plan. I thought that was kind of interesting that it was up there in the top six. And I think a lot of times it's because someone has a certain condition, or they have a certain medication, or they have something going on. It's amazing how many times I'm asked, is chiropractic covered in this plan? So I can understand that. I just didn't realize it would be quite that high up there. And then, of course, simple to understand. I sure wish that people would have that a little higher, but that is obviously a huge deal. People want to be able to understand their health plan. Who wouldn't? But health insurance is so dadgum difficult to understand that it's not surprising that people just want that is something, man, if I just understood my health insurance better, maybe I'd be able to utilize it better. So nothing surprising in this report, but I think that it really shows us, if we're going to help people understand that there's a better way to do things, we still have to keep in mind this is what they want. And so we have to build the plans to make it look that way. But it's great to know this information. Otherwise, you're still kind of behind. You're beating that dead horse, as it were, because people aren't going to want to make that change. All right. Hospital transparency. Yes. Oh, wait. That's right. There is none. Yeah. Sure enough, still, it appears that most hospitals are not complying with the price transparency rules. In fact, after 3 years, only 34.5% of the 2,000 hospitals that were reviewed were in compliance, according to a report by Patient Rights Advocate. Now, here's the interesting thing. That number, 34.5, remember that? Well, last year it was 36. So we're actually backsliding. There's less compliant now than there were last year. And here is I think the biggest notation of all. None of the hospitals owned by the largest hospital systems were fully compliant. 0%. Zero. Including big names like HCA and, surprisingly, Kaiser Permanente, because Kaiser kind of prides itself on having its own plan and some of the transparency things. But nope, not a single one of Kaiser's, whereas they had a number of them last year. A bunch of them fell out this year. So I think that it is interesting that we're in this situation. But here is why, in my opinion, there's absolutely no reason for you to do it if there's no penalty. And while there is a penalty in words, there is not a penalty in reality, because almost no one is fined. There's been so few fines put out there, so few letters even stating you're not in compliant, even though the government has stated multiple times they realize that people are not in compliant, they're not doing it. They're simply not taking any action. Once again, the same thing that I tell you all the time: if you're waiting for the government to take action, you're going to be disappointed. But it is a continuing situation that is, I think we can overcome it, but you overcome it by doing direct contracting within your plan and working with the hospital systems that are willing to give you that pricing. So there's ways around it, but you got to take things into your own hands. All right, finally, we've had a few Department of Labor rules come out here recently, and they've caused a stir, no doubt about it. Excuse me, it always does. Anytime that they make any action, there's always going to be some type of reaction, right, from the industry. And we're going to talk about a couple of those now. A couple of lawsuits that have been filed. The first one was going after the Retirement Security Act, which in particular is putting that was emphasized a lot on annuities, in particular fixed index annuities. And so, not surprisingly, 9 insurance trade associations filed a lawsuit last week against the department seeking to overturn that rule. saying that it exceeds the department's authority, is arbitrary and unconstitutional. Now, these are the same things that they said about the almost a very similar rule in 2016, and that ended up being overturned. And this is, in their words, this is just kind of a rewrite of the exact same situation. From what I've talked to and some of the folks in that side of the world, they agree it is more or less the exact same thing that they're looking to do again. But we'll see where it goes. But the interesting thing about this particular one is, while it's not the exact same rule, there was another rule put in place against fixed indemnity health plans. Now, a group from the health insurance world has now filed a suit against Department of Labor and against, they added in Health and Human Services and the Treasury Department for adopting the regulation that required sellers of fixed indemnity health plans to include a notice declaring that the product, in big letters, is not health insurance. Now, by definition, it is health insurance. By definition, it's actually more health insurance than health plans on the ACA, because there is no underwriting. There is no sharing of risk in those. In these, there are underwriting and sharing of risk. Therefore, these are actually insurance, and ACA plans are not by definition. However, they are going to be required to put on there, it's not health insurance, even though it is regulated as such. Yeah, I know. I don't get it either. So it's interesting that this has occurred, and we'll see what happens in this. But I think one of the reasons that they're upset, first of all, is it has to say that. But apparently, in the initial discussions with regulators, they said that the warning notice, the regulators said the warning notice would simply state that fixed indemnity insurance was not comprehensive health insurance. It is not. So that statement is true. So I think it's very interesting that there is this, slight difference in the way that they looked at it, but it's a big difference in this particular case, because the wording in this is everything. The wording in this changes the whole product, but it doesn't change the product. So understand it changes the perception of the product. Even though the product itself is still insurance, they're saying it's not. So I really think it's a very dramatically different point of view, obviously. But once you get the government involved, they have no idea what's going on, and they just make knee-jerk reactions, knee-jerk rules in many cases. In both the fiduciary rule and this health rule, in almost all the cases, they completely dismissed all of the, even from Congress. Congress had comments on this, industry had comments on this, and they just dismissed all of that and did what they wanted to do anyway. So both of these lawsuits have been filed here in Texas, and with the same courts that kind of overturned stuff like this before for government overreach. So we'll see where this goes, but I do think that it's gonna be a little bit drawn out process, right? None of this ever happens quickly, but it will be interesting which way it goes. The reason why I bring up both of these together is because if one of them is heard before the other, it literally could set a precedence on what is acceptable in this and how much power the government has to make these rules whenever they, once again, just kind of arbitrary rules that are really beyond their reach, as both of these claim. So I think if one of them gets that done, then the other one very well could get that done as well. It's a very, it's a slippery slope, right? I understand why the government wants people to understand that it's not health insurance as far as comprehensive. Same reason they wanted that on short-term plans. But I will say that at least the indemnity folks, they did dodge a bullet, and, they completely shut down the short-term thing other than for a 3-month interval. Whereas at least you can still sell the indemnity plans, although I do question how many will be sold when you got to put real big across the front of it. It says not health insurance. There's obviously ways around that. We offer a lot of non-health insurance products that are actually much better than health insurance products. But you have to go through that, and you have to go through that explanation to make sure people understand it. But at least we're not in the situation where they are, where you're saying it's not health insurance, but it is regulated as health insurance by the state. So it's a very different situation for Indemnity versus the type of medical cost sharing plans that we offer at EagleCare. I mean, we offer regular products as well, but I think it's very interesting that they have put them in behind this 8 ball, as it were. All right. So do we have any? I'm just going to stop for a second, see if there's any comments that anyone has. Don't forget, you can put those right there in the comments, and in most cases, it will come across. If you are watching this later, we do follow up with the comments that are in the comments later. So if you make a comment later on after it's been posted, then we can follow up with you as well. And if you want links to any of this stuff, a lot of times we'll put that there as well. All right. I am not seeing any comments come across. Let's see here. Make sure. Nope, I don't see any. All right. Hey, guys, once again, appreciate your patience with us not getting this out every week as we planned, but we will certainly try to be more diligent in that. Appreciate everyone being here today. Everyone have a super blessed week, and we'll catch you next week on the Kickstart. We are out of here.